Yeah, start Mana. So last what we spoke was Colchicum. Okay. So what we'll do is we'll quickly have a small revision, and then the leftover part, the remaining part of Colchicum, we'll try to finish. Okay. So any quick questions before I start? Before I start, you have anything to ask? ಏನಾದರೂ ಕೇಳೋದಿದೆಯಾ? ಎಲ್ಲ ಕ್ಲಿಯರಾ? Okay. So if everything is clear, then we'll have a small recall of what was done, and so we'll have a small recall of what was done, and this will also help us proceed further. Okay. So what is the action of Colchicum on joints? Major causes? Inflammation. And which joints you see Colchicum? See, it can act on all joints, but predominantly the action of Colchicum is on small joints. Okay. So one thing is good, it acts on joints causing inflammation or rheumatism. First point. Second thing, moving further, recall the action of Colchicum on kidneys. Inflammation. Very good. Nephritis. See, now these things become very important. To understand the remaining part of Colchicum, I need a clarity that you have understood the first part, because both are linked. Hope I am clear. So on kidneys it will cause inflammation, what we call it as nephritis. Absolutely right. Okay. What is the action of Colchicum on GED? What is it? Yeah, it can cause gastric, or it can cause distension of abdomen, or it can cause bloating of abdomen. Yeah, agreed. Okay, good. Anything else? Okay. So the next very important thing is, what is the cause for nausea? Smell. So in Colchicum, what you see is they are very, very sensitive. What are they sensitive to is they are sensitive to the smell. So any smell of food, what type of food? Mainly cooked food. Fine. Smell, thought of food in Colchicum will cause nausea. Okay. We'll again take it up more in detail. Character of urine in Colchicum? Dark, scanty. One word, very important in Colchicum is inky. Inky. Urine resembles like that of ink. Inky urine. Okay, good. Now probably one last thing. The desires of Colchicum. Mustard, red wine, coffee, cold things. 4 desires I mentioned: mustard, red wine, coffee, and cold things. Okay. So we have clarity in all these things. Okay. So now what we do is, today's session, some objectives are set in. So we look at what the objectives are for today's class, and if you just see here, as I just promised, we will be trying to take up the remaining part of Colchicum. So what is remaining in Colchicum is what we are going to discuss today. So if you just see here, the first thing we will be speaking is the mind symptoms of Colchicum. What we call it as the mental symptoms of Colchicum. That will be the first objective. And second thing is, I will be telling you a few important particulars of Colchicum. What a first year student should know, what we say must know in Colchicum is what I will be describing in detail. So this will be the particular symptoms of Colchicum, and the last part if you just see here, the general modalities of Colchicum will be explained in detail. Okay. Hope the class objectives are very clear. Okay. Now if these things are clear, we'll take one by one. We'll try to understand one by one. See, from the ailments that you have read, what could be the probable mind symptoms of Colchicum? Okay. I should have given you the clue, but what could be the probable causative factors in Colchicum? Sorry, what could be the probable mental symptoms of Colchicum? Meaning, why did I ask you this question before explaining mind? Because we had discussed something under under ailments from. So with that liberty, I am asking you this question. What could be the probable mind symptoms of Colchicum? Okay. Now what were the ailments related to mind disorder? Related to mind. Grief, yes, very good, grief. Anger, more than anger. More than sadness. Yeah, I told you something, some wrong happening. Wrong happening, Colchicum cannot take it. What was the word we used? Misdeeds of others. Okay, misdeeds of others. So what you basically see in Colchicum is, Colchicum basically, before this, it might come a little later, they are very irritable people. They are very angry people. Okay? And they are the kind of people who cannot see anything wrong happening. Okay? They get very irritated. They get angry. And what was the word we used? Very good. Indignation. Indignation. And I also told you, you also have another remedy in your syllabus, and that is Colchicum. Colchicum. So Colchicum people also, something wrong happening. They get agitated. They get angry. Anger for right reasons. Anger for righteous reasons is what we call it as indignation. कुछ गलत हो रहा है, ಕೆಟ್ಟದ್ದು ನಡೀತಾ ಇದೆ, and you get angry, you get irritated, ಕೋಪ ಬರುತ್ತೆ. That is indignation. Clear? Okay. So what you also have in Colchicum is they have a lot of. Any wild guess what could be the probable problem related to mind? Who are the people who keep sticking all these things? Yeah, very good. People who forget. As a reminder, आप चिपकाते हो, fine? It's just a reminder kind of a thing. So, Colchicum has issues with memory. Weak memory, confusion, can read but cannot understand a short sentence. Confusion from interpretation, logical thinking impossible. They can read, but they don't understand. Your material teacher would have told you to read Colchicum from Kent's Material Medica. Yes sir, we all read. Yes, we all read. But how much did you understand? How much you are able to recall or how much you are able to remember will become a problem. Sir, trust me sir. Yesterday, I read. Yeah, I trust you. But then there are issues. So memory issues, okay? Forgetfulness, memory issues, memory weakness, which mainly comes from mental exertion. Now what do you understand by mental exertion? Mentally you are more exerted, meaning like for example, you are straining your mind too much. Exams hai, you have some term test coming up, you are working too hard. Okay, entire remedies you are trying to read a night before your exams. So what is happening to your mind? Your mind is getting over-exerted. Okay. Now what is that weakness of memory he has in Colchicum? For what he has said, for what he has said, for what he was about to tell, and what he was about to write. I hope you understand this. Weakness for what he has said. Common thing, we see kids telling in Viva, sir, trust me sir, I just said, before entering your Viva, I just said. So for what he has just said, he forgets, or what he has just said. मैं कुछ बोला ना अभी, क्या बोला मैं? Right? So he forgets that. या आपको कुछ बोलना है. You want to tell something, and you forget what you want to tell. Okay? And what you are about to write. कुछ लिखना है आपको, आप भूल रहे हो. You are not able to recollect. So these are the issues you have in Colchicum. Hope I am clear. Boys, right? Fine. So memory issues, confusion, memory weakness, okay, fine, concentration difficult, understanding difficult, these are what you have in Colchicum. So remember this, it can be very handy in future, and this is something we just finished. Now what did we finish here is that Colchicum is very irritable, is an angry kind of a person, and very discontented. What is discontentment? Not happy with anything. Yeah, this is not the image, but generally they are very time conscious, fine, very punctual, fine. At the same time, they are not happy with with anything. Kaisa tha biryani? Thick. Right? Right? How was this? How was that? How am I looking? Nothing can satisfy you. Nothing can make you happy. Discontented people. So colchicum can be discontented. And then you also have this very, very important, what we saw. What is it that we saw here is, like, misdeeds of others can bring in lot of anger. Okay? They can go wild from anything wrong happening. And last thing, which I also told you was, what is it we saw under the LMS? Very good. They're sensitive. What are they sensitive to? Rudeness. And what did you understand by rudeness? Rudeness meaning what? What did I tell you in the last class? What defines rudeness? Rudeness is more to do with the tone. What did I tell you? जो बोल रहे हो ना, जो डांट रहे हो ना, प्यार से डांटो. कोई प्यार से डांटेगा क्या? नहीं. लेकिन what is the sensitivity of colchicum? This is what colchicum expects. पहले तपनेला, but निदान अष्ट जोरा क्या है? Why are you raising your voice? What you are trying to tell? Please tell softly. Because I can't take notice. That is colchicum. There are many more remedies you will be studying in future. Sensitive to external impressions, sensitive to rudeness. These are few things you need to remember. Okay. Now before I take the bodily symptoms of colchicum, for a first year student, I have tried to give you what is required under mind. Now, what did you understand? A broader picture of colchicum mind. They are irritable, they are angry, and any wrong happening, they cannot take it. Right? And again, they are very, very sensitive. The basic nature of colchicum. And as you see further, they also have issues with concentration. There are also people who have problems with memory, and they can land up being confused. Bas. This is the mind. We did arsenic. Okay, we did aconite. Their mind be elaborated in detail because there was so much of mind symptoms in those remedies. Here, the mind symptoms are very minimal. We will focus on something which is more important for a first year student. Okay. Now, before I take up this, what is the meaning of particular symptom? Pertaining to particular. You are almost 7-8 months into homeopathy, 7-8 months into materia medica. I know you will be knowing the meaning. But particular symptom means a symptom pertaining to a particular part. These are all Viva questions. We should be very, very careful. Okay. Now, I have also given you a formula how exactly one has to study particular symptom. Now, what is that formula? What is that formula? First, remember. Very good. Good. I like that first heading. First, remember the sphere of action. Second thing is very good. Ailments from. Third thing is characteristic symptoms. And fourth thing will be modalities. If you know these things, then it will become a very easy task. Okay. Now, another question. Where do you see colchicum predominantly active? So joints, yes, good. Joints, GAT, very good. And kidneys. So our focus for next few minutes will be the action of colchicum on the GA. Very important. This is important for your practice as well as your theory. Okay. So GA is what we'll be exploring in detail. We'll be also looking at the joints, very important. And the last thing that we'll be looking up here is the action of colchicum on kidneys. Done? Clear? Okay. So hope this image gives you some clarity. Okay. Now we will explore. We'll explore the GA symptoms. Now before I start giving away the GA symptoms, from the introductory classes, under J, knowledge of anatomy. Okay? So when we say GAT, what is it that from the mouth till the anus. Fine? Till the anus. Okay? Now, think what could be the probable symptoms that can come up in Colchicum J. Very good. So we can talk about nausea. Good. That is a very important heading in Colchicum. I appreciate. Very good. Nausea. Anything else? Vomiting. Good. Yes, good. We can explore vomiting. Good. Now, what made you think of nausea and vomiting? No. What made you think of nausea and vomiting? Because they are part of J. So nausea and vomiting is a result of J being affected. Very good. Good. Okay. Anything else? Okay. Possibility of a mouth ulcer. Good. It is not there. No issues. Don't worry. But good thought. Do we have mouth ulcers in Colchicum? Is a question. Good. Nausea, vomiting. Good. Anything else? Please be a little louder. Diarrhea. Some boy is shouting diarrhea. You all agree with diarrhea? But why I was not giving a good hearing to diarrhea? Because diarrhea is something that comes here. So when it is diarrhea, then it is anus end. But I want you to explore a lot of other areas here. Okay, very good. I come to diarrhea, which our boy told. Absolutely right. Diarrhea is there. But what else you have in between? You can also have the abdominal part. What will happen on the abdomen? You see bloating. Good. Bloating, nausea, vomiting, distension of abdomen. Is there a possibility of a mouth ulcer? And stomach, what else you can think of? Acidity. Good. Yeah, I'm happy for a first year student. Very good. Acidity, gastric. Good. Inflammation, desires, indigestion, all these things. Very good. So we'll go stepwise and we'll just see here. See, unfortunately, you don't have much action of Colchicum related to the oral cavity. So we are directly talking of the action of Colchicum on the stomach. Typically, we should have started with mouth, but nothing characteristic. So I'm directly talking of stomach. Fine? Okay. So what do you expect under stomach? Now can you also add another heading? Sphere of action. Acting on the GA. What will Colchicum cause? Colchicum causes nausea, vomiting, and it can also cause distension of abdomen. Good. What are the ailments? I gave you a list of ailments. Can you think of some ailments which can cause gastric complaints? Smell of food, very good. Yes, good. Cold food, smell of food. Thought of food will cause vomiting, nausea, good. Anything else? So the first important ailment under GA is loss of sleep. What is it? Loss of sleep. So night watching, loss of sleep, overstudying. See now what happens in Colchicum is when a person is not sleeping properly, morning he gets up weak, and see the beauty in Colchicum, the system, the weakest system gets affected. So loss of sleep, directly G is getting affected. And he lands up with nausea and he lands up with vomiting. So ailments from, you'll have to remember the sphere of action, and then you'll be talking about nausea. What is the speciality of nausea in Colchicum? When do they get nausea? Nausea at sight and nausea at smell. Nausea at sight and smell of food. Only sight and smell? Your thought, thinking about food can bring on nausea. Okay, good. Anything else? So somebody also commented that it's not only nausea, sir, you can also have vomiting. Now what do they vomit? They can vomit food, or worst case they can also vomit bile. Worst case they can also vomit bile. Okay. So sensitive to odor, and this sensitiveness is what is bringing on nausea, vomiting, and they can also faint. They can also be fainting. Nausea, vomiting, fainting. Nausea at the thought, sight or smell of food, especially of cooking, and eggs and fish. disagrees. Colchicum patient cannot tolerate egg or fish. Okay, I will be showing you some images a little later. Yeah. Okay, fish is something they cannot like. Sir, I don't like the smell. Why? So smell triggers nausea. Smell brings on nausea is the complaint what a colchicum patient can have. Okay? Vomiting of bile, vomiting of mucus or vomiting of whatever he or she has eaten. Okay? Vomiting of bile, burning and icy coldness in stomach and abdomen, and nausea in pregnant women. I expected this because what was our starting thing in Colchicum? I shared a case of a lady whom I had given Colchicum for nausea, morning sickness. So, nausea in pregnant women and amelioration lying quiet. If she lies down quiet, there is no nausea. If she gets up, if she starts eating, if she starts drinking, then she starts puking. Colchicum. Very important. Colchicum. Okay? So any quick questions here? Stomach? Okay. So moving ahead, what you observe is, see, Colchicum has desire to eat many things. जैसे ये पसंद, जैसे वो पसंद, सब कुछ पसंद, एल्ला इष्टा होंगे. But unfortunately, can he eat all these things? Why? Because you know, the smell of this can bring in a lot of nausea. She wants to eat everything, fine, and good husband, you would have ordered everything, but unfortunately, you know, she's not able to eat because of the smell. You will enjoy the smell, yeah, fish smell, smelling so nice, egg smell, but Colchicum, because of the oversensitiveness of the nerves, okay, the olfactory nerve, it will cause bad nausea and bad vomiting. So desire to eat many things, but is averse to them when smelling them. You had a similar situation in remedies like Sina is done, Chamomala is done. Can somebody quickly relate something similar? But what happens in Sina? They want many things. Chamomala wants many things. When offered, what do they do? No, I don't want this. Soup. Dad orders soup. No, I don't want soup. I want starters. Dad orders this. No, not this. I want this. I want that. So the issue in Chamomala Sina, what is the word we use there? Capricious. Beautiful, good. Capricious. They are not very clear. They are dissatisfied. They are impulsive. Lot of things. Restless, stubborn. Lot of things adds into capriciousness in Sina Chamomala. Here they are not capricious. Here they have that willingness to eat. But unfortunately, because of the nausea, they are not able to eat food. Clear? Okay. So, smelling, it will cause problems, and I just told you, eggs disagree in Colchicum. Motte agalla, motte ishta illa avrige. Right? And yeah, this is, the desires can also be included under stomach. Okay? So 4 desires we spoke was mustard, coffee, red wine, cold things. Cold things, okay? So these are the desires a Colchicum patient has. So what did we finish now? Which part? In the GED? We spoke of the stomach. Now we will talk about the abdomen. Now you told me a little while ago, the action of Colchicum on abdomen will be bloating. Is it simple bloating? There is immense bloating. Okay? So what you have in Colchicum is bloating of abdomen. Bloating of abdomen. Okay? So abdomen is immensely distended with gas, and what is the sensation a person has is he or she feels because of the bloating, because of the distension, abdomen will burst. Abdomen will burst. Clear? Okay? So this is what we were writing, and yeah. One more very important thing. Is colocin done? Colocin agide? Yes. So what do you have in colocin? Can somebody quickly relate this with colocin? Colic pain better by bending double or bending forward. This similar colchicum. You have a colchicum. So 2 remedies. As a first year student, you should remember colic, pain abdomen, better by bending double. You have colocin number 1, and number 2 what you have is colchicum. Colic aggravation eating, colic amelioration bending double. Pulsatilla colica will come later. But colocin is what you should remember as a first year student. Another very important thing related to abdomen, what we also saw in many other remedies is, what is this? What is this? There is dropsy. What is the meaning of the word dropsy? Dropsy means edema. Swelling, edema. Okay? Accumulation of fluid. So what is this from the anatomy? Dropsy of peritoneum. What is it called? Dropsy of peritoneum. What is it called? Ascites. Ascites. So this is what we do in CBDC. We are trying to correlate or we are trying to integrate anatomy with materia medica. Ascites, very important. Any other remedies you can think of for ascites? Cinchona, very good. Yes. Apis mellifica, very good. Cinchona, apis mellifica. Yes, metformin done? No, good. Cinchona, apis mellifica. Beautiful. We'll go ahead. Now, a small question before I take the rectum. What is that small question is, recall other gastric remedies from first year syllabus. Other gastric remedies from first year. Others, very good. Diascoria villosa, good. Carbovix, chamomilla, Sina, Cinchona, China. Is lycopodium done? No. See, good, you told me so many remedies. What is that you have in Diascoria villosa? Colic. How is it different from colocin? Colocin bending forward. Diascoria bending back. Colic bending back. They feel better is diascoria. Colic bending forward. Amelioration is colchicum and colocin. Okay. Right? And there is something called as Nash trios. These are all your Viva questions. There is a book by name Nash, E.B. Nash, Leaders of Homeopathic Materia Medica. In the end, he would have given you trios. Out of so many remedies, 3 major remedies for gas, for pain, for fever, a lot of things. So here I want you to highlight, or I want you to look for the Nash trios of flatulent remedies. Carbovix, lycopodium and cinchona. It can be a Viva question. Right? I will be doing lycopodium next, then I will differentiate all these things. But for time being, Carbovix, lycopodium, cinchona. Okay? Good. So we will be looking at the last part of JAT. One of our friend was shouting. What was he shouting? Diarrhea. Good. So diarrhea is the concluding part related to the rectum of, colchicum. So you see only diarrhea or you say something else in colchicum? Dysentery. Now what is dysentery? When stool is mixed with mucus and blood, we call it as dysentery. Okay, diarrhea can be watery stools. But when you have stools typically mixed with blood and mucus, then we call it as dysentery. Okay? So, in colchicum, you have diarrhea. In colchicum, you also have dysentery. Okay? Now, what is the kind of dysentery you have in colchicum? Okay, very good. Dysentery in autumn season, I appreciate, agreed. Good, anything else? What is the character of stools you have in colchicum? One jelly-like what? Yeah, somebody is using the word white. What is that white? Yes, white shedding of intestine. Right? Intestine layers. Scraping of intestines. White mucousy thing you have. This is very, very characteristic in colchicum. Jelly collector, mucus shedding of intestines. Very, very important in Colchicum. And you just see here, this man, he is having a lot of pain, he is having a lot of discomfort. So this is what we call it as tenesmus. When you are painful and frequent urging for stools, we call it as tenesmus. Okay? So what you see here is, like scraping of intestines, I told you, very, very important. And moving ahead, dysentery alternates with rheumatism. What is it? So when there is dysentery, there is no rheumatism. Or when there is rheumatism, there is no dysentery. Good. Unsatisfactory urging, frequent stools. Stools painful, you just saw this. You can also add tenesmus here. The word is missing. Offensive, jelly-like and autumn diarrhea. Okay? Remedies for diarrhea. Other remedies for diarrhea. Hello, good. Sulfur, very good. Sina, yes. Chamomilla, arsenicum, good. See, this is how the questions will come up in your viva. A lady aged around 30, 20 had diarrhea. Name the remedies and differentiate. This is how the question will come in your viva. So you should know what the remedies are, which you just told me. Now how do you differentiate? When arsenic? When do you think of arsenic? Huh? What? Yeah. Okay, more than anxiety. Good. Agreed. What? Yeah, what was that? Food poisoning. Food poisoning. Don't forget the word. Food poisoning in arsenic. Eating out. Food poisoning brings on diarrhea. How is the character of stools in arsenic? How is it? The sitting quite around the health. How is it? Huh? What was the word I had used? Yeah, very good. Why are you hesitating to tell? Absolutely right. It is offensive and smells like cadaverous. This is the key word. Please don't feel shy to answer. You lose marks. Fine? Cadaverous, smelling, offensive stools. Arsenic is done. How is it in chamomilla? It will be like greenish chopped eggs. Or chopped eggs? Chopped spinach. Greenish. What is the cause? What is the cause? What is the cause in chamomilla? And the dentition. Dentition. Child during dentition, he or she will have greenish diarrhea. Very cranky, very irritated, chamomilla. Okay? You get my point? You are talking of aloes. When aloes? Aloes will have early morning. What is it you have in aloes? Early morning and loss of control over sphincter in. He thinks he is passing gas, but stools would have escaped. Aloes. Involuntary stools. Very good. Sina?
Overeating.
Okay, good. Overeating. Undigested food. Worms. Stools they are passing, round worms. Very irritated, cranky, not gaining weight, not growing. Because all the nutrition, what is sucking? The worms, they are taking away all the nutrition. And very cranky, irritated, pain, itching in the anus. Sina. Some boy shouted sulfur. When sulfur? Again, early morning diarrhea, bad smelling stools. Fine. The moment he wakes up, he has to rest to pass stools. This is how you have to complete the entire thing. Okay? Fine? Okay. Now the last part, before this, what you have to realize is, what is this you see here? Urine. Okay. What remedies come to your mind? I mean, urinary remedies from first year syllabus. Epis, very good. Epis, good. Right. Only epis. Arsenicum. We spoke of the remedy. The moment it gets cold, he will have increased searching for urine. Dalgama. Okay. Urine retention, which is the remedy. Very good. You are getting my point. See, you should have that wide thinking. When I say urine, lot of things should come to your mind. It can be retention of urine, right? Or it can be frequency of urine, okay? Or it can be burning in urine. It can be inflammation, nephritis, like what you have in apis mellifica. And what I will also be discussing now, in colchicum, there will be nephritis. Nephritis. Apis will have more of stinging pains, very painful. Last drop burns, very scanty urine, and last drop you see the patient shouting because he knows how it burns, That is apis mellifica. Okay. This remedy. Now, why I am giving you the other remedies from first year syllabus is, you have to realize apis did not have this kind of urination. Aconite did not have this. Dulcamara did not have this. Arsenic did not have this. And this is seen exclusively in colchicum. That is the clarity I want to give you first year students. Otherwise, what is the common problem? Confusion, sir. Confusion, sir. इसमें भी पेशाब है, and I am confused. किस पेशाब किसका? I am confused. You get my point? Right? Every urinary thing that you see has something characteristic and it is something unique to a remedy. And that clarity I want you people to have. Colchicum में कैसा होगा? एक गिरते colchicum में dark गिरता है, inky urine गिरता है. And this is the key word which you should not forget. नहीं भूलना है. Okay? So, pain in the region of kidneys, inflammation of kidneys, this is also very, very important. Nephritis. Because of nephritis, you see bloody urine, you see dark urine, ink-like urine, a lot of albumin escapes through urine, bloody, the urine is hot, and you just saw it here, it is high colored, scanty, offensive smelling urine. And this is what you have to remember in urine, in colchicum. Okay? Clear? Any quick clarification here? Urinary complaints, all fine? Okay. So we'll come back, we'll have a quick revision so that you will have a clarity in the end. Now the last area. Now what is that last area that we have to discuss in detail here is? Joints. Correct, no? Joints. So the action of colchicum on fibrous tissue. Okay? Action of colchicum on fibrous tissue. Again, integrating with anatomy. What is a fibrous tissue? What is a fibrous tissue? Fibrous tissue is a tissue which connects and which gives support, it protects and holds bones, muscles and other tissues and organs in place. So, ligaments, tendon, the inner layer of the skin, sclera, these are a few examples of fibrous connective tissue. Okay, that's the anatomy part. Coming back to the material part. Colchicum has a special affinity for fibrous tissue. Okay, you see them acting on the tendons, aponeurosis, ligaments, joints, and even the periosteum. A better remedy acting on the periosteum? A better remedy acting on the periosteum? The injury remedies, which was there in your first year or first term. Okay, fine. Okay. So now, mainly colchicum acts on joints and it will cause rheumatism, and it will cause gout. Rheumatism and gout, very important. Okay. Now, from the characteristic symptoms we have already discussed, what are the joint complaints you can think of? Gout, yes, good. Inflammation of joints, yes, very good. Rheumatism. Any other words that you can recall from the characteristic symptoms? Osteoporosis. No, you don't see osteoporosis in colchicum. Okay. Okay. Well, I told you I insisted on some pain which was very peculiar in colchicum. Very good. Wandering pains. Wandering pains. Pain keep traveling or jumping from one joint to another. So that's why it's very important you should read the previous topic and come to the class. That is the challenge. Okay. So anyway, we'll come back. And I also wanted to give a small interaction with you. What are the other remedies from your first year syllabus which may affect the joints? Let us go, very good. Rotor, Symphytum, Arnica, Brevia, Rustums. Good. See, again I told you, a 5-mark question, sorry, a 6-mark question which can come up in your Viva in future is a lady aged around 60 years has pain in knee joints. List the remedies and differentiate. So you will have to list and you should also be in a position to differentiate. Okay? Good. Now we'll just focus on Colchicum today. We'll try to understand what Colchicum can do acting on the joints. I told you it has a special affinity for smaller joints, though it can also affect large joints. Pains, drawing, tearing, pressing. Now this is what I want you to focus. Pain move from one joint to another, from one side to another, from below upwards or from above downwards. Ultimately what I want you to realize is wandering pains. Pains which keep shifting from one joint to another joint. Can you compare Ledam here? Can you compare Ledam here? Okay, very good. Ascending, good. See, in Ledam it was very clear. Below upwards. You are getting a point? Here it is so random. ऊपर से नीचे, नीचे से ऊपर, साइड से इधर, उधर. How is it in Ledam? There is also something very important. Diagonal. Right? Diagonal. Upper right and lower left. Diagonal. Okay. So this is very, very important. And what is this? Goat. Please remember. From the knowledge of physiology, what will happen in goat? There will be accumulation of uric acid. Okay. See, before Colchicum was introduced into homeopathy, it was used by allopers in treating gout. Okay. Before, it was introduced into homeopathy, allopers were abusing Colchicum for gout. So gout, when the great toe, please also remember this area, great toe is where gout generally, pains happen, uric acid get accumulated. Pain in great toe, gout, the other remedies, gout. One remedy can be Ledam, the other remedy can be Arnica. What is it? Ledam and Arnica. And I also told you about Colchicum. So gout pains, inflammation of great toe, gout in heel, can't bear to have it touched or moved. Touching the joint, patient will not allow or is not able to move. Slight movement aggravates the pain. Okay? Rheumatism associated with flatulence or nausea. Rheumatism associated disorder. Alternating, right? Rheumatism alternating with sediment and offensive urine. Okay, urine will be sedimentous and it can be offensive. Valvular heart disease or the pericardium getting affected after rheumatism is cured. So rheumatism is better and then the patient complains of heart complaints. One remedy, there are many remedies in homeopathy. One remedy you can think